Hello everyone, welcome back to LIFEHUE YouTube channel. This is the first video of our complete general medicine series. In this series, we are going to cover practical as well as theory topics of general medicine. This is of very importance to BDS student. So this video is about the topic clinical methods. After that, we will know about gastrointestinal system, hepatobiliary system, cardiovascular system, respiratory system, hematology, renal system, central nervous system, infection, endocrinal system, nutrition, critical care, emergencies in dental practice, anaphylaxis, and drug allergy. Each one by one. In this topic, clinical methods, we will know about the art of history taking, physical examination, scheme of general examination, and then about various systemic examinations. So talking about the history is the physician's abstraction of certain facts and developed in the course of patient's interview and arranged in a manner that facilitates diagnosis. Proper history is important for making a correct diagnosis. This is the standard format used for history taking, in which we firstly ask the patient about their name, age, sex, marital status, occupation, and address. These patient's details are very important for medico-legal as well as communication purposes. Then we ask about the main problem or chief complaint for which the patient has come to the doctor. These problems are listed in a chronological order of their appearance. Generally, the patient is allowed to tell by himself. Then we take the history of present illness, in which leading questions are asked about the symptoms. Like if patient is complaining of pain, details should be recorded about site, severity, character, radiation, duration and timing, relieving and aggravating factors. After that, history of present illness, we take the history of past illnesses. A detailed account is noted about the illness which occurred in the past. Then we take treatment history, in which the details of medication taken are noted, and history of any adverse effects of the drug is also noted. Then we take personal history of the patient, which includes dietary history, appetite, work pattern, bowel and bladder habits, and any addiction patient have. Then we take family history. In this, any history of genetic disorders in the family is inquired about, and any history of similar illness in the other family members and cause of death of immediate relative should be recorded. If our patient is a female, then we asked about menstruation, regularity of cycle, duration of cycle, and amount of bleeding are noted. After taking detailed history of the patient, we move ahead for our physical examination, in which we start with general physical examination. General physical examination usually start at the very point patient enters your clinic. We look for mental and emotional status of the patient, their facial expression, their walking pattern. After that, we look for the build of the body. The physique of the patient can be short, tall, obese, muscular, thin, or asthenic. Then vitals like temperature, pulse, blood pressure are noted. The temperature is measured with a thermometer and its normal ranges from 37.2 degrees Celsius to 37.7 degrees Celsius. In pulse, we examine mainly for the things like rate, rhythm, volume, character, radiofemoral delay, and synchronicity. Then, blood pressure is measured with the help of sphygmomanometer. Normal range for blood pressure is, for systolic blood pressure, it is 130, and diastolic blood pressure 90 mmHg. After that, we measure jugular venous pulse. It provides an estimate of central venous pressure, and hence it denotes volume status and cardiac function of patient. After jugular venous pulse, we look for respiration. Normal rate of respiration is 12 to 16 per minute in adults. Any deviation is also noted. Then, the presence of pallor depends on the thickness and quality of the skin, amount of blood in capillaries, and quality of the blood in the capillaries. The evidence of pallor is looked at palpebral conjunctiva and mucous membrane of the mouth. Other sites are nail bed and palmar creases. After pallor, we check for jaundice. It is a yellowish discoloration of skin and oral mucous membrane due to deposition of bilirubin. Normal total serum bilirubin level is 0.3 to 1 mm per deciliter. Then we look for clubbing, which is the enlargement of the distal portion of the fingers and toes due to proliferation of connective tissues. We have made a detailed video on clubbing on this channel. You can find it out and look for it. Same for cyanosis, which is a bluish discoloration of skin and mucous membrane caused by increased quantity of reduced hemoglobin in superficial blood vessels. We have made a detailed video on it. Edema. Edema is the presence of excess of fluid in interstitial spaces causing swellings of the tissue. Then we examine for lymph nodes, size, number, texture, tenderness, mobility, and any sign of inflammation over the nodes. Then we look for nails and to examination of hands. After that, halitosis is seen. Halitosis is an unpleasant odor or smell emerging from the mouth or nostril that is detected by the patient or others. It is also referred to as bad breath. Now, when we have know about physical examination, let's move ahead to the scheme of general examination. This is a detailed list of the things we look during general examination. So we start with general physical examination, which you have learned just now. We look for general appearance, mental status, build, height and weight, and measure BMI of the patient. Then decubitors, which is the pressure source in bedridden patients. Then we look for the vitals of the patient, which includes pulse, innate, rate and rhythm, character and volume, symmetry. After that, blood pressure, temperature, and respiration. All are measured. Then we move head to toe examination. So we start with eye and note down exothalamus, ptosis, eye movement. Conjunctiva is look for pallor and icterus. Pupil size, reaction to light and accommodation is noted. In face, we note for symmetry, puffiness, cyanosis, and also check for parotid glands. We will study about examination of parotid glands later. In oral cavity, we look for odor, lips for denture and other abnormalities. Gums, in gums we see for swelling, bleeding, inflammation, ulcers. In tongue, we look color, appearance, ulcers. And in buccal mucosa, we look for color and ulcers. Then pharynx is checked for tonsils, oropharynx. In neck, we see JVP, which we just read. Then thyroid, lymph nodes, cervical lymph nodes. In upper limbs, we check nails, clubbing, koilonkia, pallor, cyanosis, pulse, blood pressure, lymph nodes. In lower limbs, we see edema of feet and ankles. So let's revise. In clinical methods, we studied about the history, physical examination, scheme of general examination, and systemic examinations. History is noted in detail, in which we start with patient detail, then move ahead and note down presenting complaints, history of present illness, history of past illness, treatment history, personal history, family history, menstrual history. After that, we do physical examination of the patient, starting with general physical examination, build of the body, temperature, pulse, blood pressure, jugular venous pulse, respiration, pallor, jaundice, clubbing, cyanosis, edema, lymph nodes, nails, examination of hand, and halitosis is noted. Now we studied about scheme of general examination, in which we see general appearance, mental state, build, height and weight, decubitors, vitals of the patient are noted. Then we do head to toe examination, in which eyes, face, oral cavity, pharynx, neck, upper limbs, and lower limbs are examined. We will study about systemic examination in next video. If you like this video till now, please like, share, and subscribe to the channel. Share the video and share your views about the video in comment section. And if you want a video on any topic in detail, you can also comment it below. Thank you.